The following exercises may be started the day of surgery in your patient bed and should be continued after discharge from the hospital.
Ankle pumps are performed by moving your feet up and down towards your head and away from your head. Kirsten's doing a very good job. She's going through her full available range of motion, performing the exercise nice and slowly. Ankle pumps help prevent blood clots, aid in circulation in your legs. In this position, you may also do ankle circles. They're performed by making big circles with your ankles. You can do both legs at one time. You can do one leg at a time. You can pretend you're writing your name in the sand on a nice warm beach, as long as you're getting movement in your ankles to help push blood through your calf muscles. Quad sets can be performed laying down in bed. The exercise is performed by pushing the back of the knee down into the mattress, flexing the quadricep muscle in the front part of the thigh. You'll notice that when Kirsten flexes her muscle, you'll get a movement of the kneecap up towards the hip, and you'll see the muscle belly tighten in the quadricep muscle. She holds for a count of 5 and then relaxes. You can perform 10 repetitions several times a day. Sitting heel slides. Sit forward on the edge of your chair or bed. Bend your knee back as far as possible and hold for 5 seconds. Then straighten the knee as far as possible, tightening the quads, and hold for 5 seconds. Bend the knee back as far as possible. Hold for 5 seconds. Repeat 10 times. When at home, you need not have a skateboard. If you're on a hardwood or linoleum floor, you can place a towel underneath your foot and slide the foot back. Or if you're on carpet, the lid of a shoebox works well to create a friction-free surface. Assisted knee flexion. Sit on the chair or a bed. Bend your knee back as far as possible. Plant your foot firmly. Scoot your buttocks forward towards the edge of the chair, increasing the amount of bend on your knee. You will feel a strong stretch across the top of the knee and into the thigh. Hold for 5 to 10 seconds, and then release the stretch by scooting back onto the chair or the bed. Remember to keep your foot planted firmly so it does not move or scoot forward. Go ahead and scoot forward again. For demonstration purposes, in order to show the amount of bend in the knee, we are over-exaggerating how far you will need to scoot forward. Hold for 5 to 10 seconds, and then release the stretch by scooting back onto the chair or bed. Assistive knee extension or hamstring stretch. Scoot forward on the edge of your chair or bed. Place the heel of your surgical leg up on a stool. Tighten the quads fully to straighten the knee as far as possible into extension. Hold for 5 to 10 seconds and then relax. Think about pushing the back of the knee down towards the floor to get the knee as straight as possible. Hold for 5 to 10 seconds and relax. You may also apply gentle pressure on the thigh above your incision to help push the knee to get it completely straight. Hold for 5 to 10 seconds and relax. Repeat 10 times. Lie on your back with your knee straight. Place a small towel roll under your ankle and maintain this position for 20 to 30 minutes or as tolerated, 2 to 3 times a day, to help stretch the hamstring muscles, facilitating a straight knee. Knee straightening over towel roll or short arc quad. Place a large towel roll under your knee, keeping the back of your knee pressed to the towel roll. Straighten your knee as far as possible. Hold for 5 seconds and lower down to starting position. Following your knee surgery, you may not be able to do this exercise by yourself. If that is the case, have a family member assist you underneath your heel. Have them help you lift the leg up, keeping your back of your knee pressed to the towel roll. You should still try to straighten your knee even though your family member is assisting you. Hold for 5 seconds and then relax. Kick up, hold, and relax. This is the only time the doctor wants a pillow or a towel roll under your knee. Straight leg raises are to be performed in bed, lying on your back. Bend your opposite knee up and put your foot on the bed. Tighten the quadricep muscles. Keep the leg as straight as possible and lift the leg 12 to 15 inches off the bed. Hold for a count of 3 to 5 seconds and lower down slowly. Remember to keep the leg as straight as possible during this exercise and to do your quad set first, tightening the quadricep muscle before you lift up. Repeat 10 times. Patellar mobilization. Sit forward on the edge of your chair or bed. Straighten the leg as far as possible and put the heel on the floor. Using your hands, find the edges of your kneecap and glide it from side to side. Then with your thumb and forefingers, grasp the edges of your kneecap and glide it up and down. This should be a gliding motion. Avoid downward pressure on the kneecap. Repeat 10 times each direction. Remember to keep the quadricep muscles relaxed. When they are tightened, the kneecap is locked into place and you can't move it. Also remember to keep your knee straight as possible with the heel on the floor. If it's bent, the kneecap is locked into position and you are unable to move your kneecap. Knee straight, heel on the floor, and quadricep muscle relaxed. Nice, smooth gliding motions.